Hello everyone, I am Dr. Senthil Kamalasekaran, Senior Consultant Orthopedic Surgeon at Chennai Ortho Clinic, and today I am going to talk to you about what to expect before, during and after knee replacement surgery. So, what is knee replacement? Knee replacement is a joint resurfacing operation procedure in which the worn out cartilages of your knee joint are replaced with artificial metal and metal prosthesis along with a highly cross-linked polyethylene, so that you generate a joint which will mimic your own natural joint. By this procedure, you take away the nerve endings in your worn out joint which causes pain, and also we correct the deformity which is there in your knee to give you a knee which becomes straight and well aligned and can help you function with your day-to-day activities without any pain. It has become a very common procedure nowadays, and of late we have started doing, along with the traditional knee replacement surgeries, robotic knee replacement procedures, in which we take help of a robo in which we have fed your scans and are able to give you precise cuts to generate a joint which is pain-free and help you to mobilize. Now, the most important thing for you to expect from the procedure, because many of you who are going to have this procedure are very apprehensive about it, is to have faith in your surgeon. So that is the first thing you need to have. You need to be confident and you need to be having a very good perception of the procedure before you go in for the surgery. So before the procedure, you will be analyzed by your surgeon and they will take a good history from you and check your medical profile for your diabetic status, whether you are on blood thinners, those kind of things, your hypertension, what medicines you're taking, everything. So once that has been analyzed and based on your x-rays, which are usually done in the standing, we come to an assessment that if you need a joint replacement, what you need. So even before the surgery, what we start off, which we call prehab, we ask you to go and meet the physiotherapist who will teach you some exercises which you can practice at home, mainly straight leg raise and doing a quadriceps drill to keep your muscles active. Because what will happen after the procedure is you will have to do these exercises in hospital to gain your mobility. So first is that you need to prepare your home for yourself after you come back from the procedure to make sure that your surroundings are safe. You might need to have your toilet seat elevated. You might need to have a handrail fitted so that when you are getting up, you might need some support when you're getting up from the toilet seat. So these kind of small things done before the surgery will go a long way to help you progress faster after you come back home from the surgery. Just before the surgery, we will ask you to see the anesthetist, and the anesthetist will be able to tell you on what kind of anesthesias they usually use for these procedures. We have different kind of anesthesias. They will be able to give you a regional anesthesia like a spinal anesthesia or an epidural spinal anesthesia, or they might even give you a general anesthesia. Each one varies and each of them are helpful in giving you some kind of relief during the procedure. So what the spinal anesthesia helps you overcome the pain of the procedure by blocking the sensations below your hips. The spinal epidural anesthesia helps you recover from the procedure and also helps you to have some pain relief after the procedure by use of the epidural catheter, which is usually inserted in the spine. So you have some top-up anesthesia during the initial periods of the post-surgical period when you have high pain. The other anesthesia, like the general anesthesia, are useful for those people who are very apprehensive to injections, and they help you to, and usually they sedate you and give you a general anesthesia, so you are not aware of the procedure when you have it done. So that's during the procedure. So even immediately after the procedure, what they can do is the anesthetist can give you some kind of anesthetic pain blocks which can numb the leg and help you to have the function of the muscle but can just take away the pain. So these kind of things help you in your immediate post-op management. Most of my total knee replacement patients are able to stand the very same day and are able to walk the very next day. Most of them are able to take their stairs by the third day and have completed the toilet training and are very safe to be discharged by the third day. So that is the amount of speed in which most of our knee replacements are happening in the modern scenario. Some of them are so fast that in a couple of days they are able to go back. However, it's best not to rush, and it's well advised for you to come prepared that you will be in the hospital for a short period of time and you will get relief and then go home safe. Immediately after the procedure, what do you expect? There will be some amount of minimal pain post-procedure, and this can be tackled very easily with good painkillers and good anesthesia. Physiotherapy is paramount, and if I was to stress upon one thing after your knee replacement, be prepared for the stiffness which will come along with the procedure, and you need to work very diligently with your physio to get your full range of movement quickly. So that's why I say practice your exercises even before surgery. So even when you come into the hospital, you are well aware of what you can expect from the physios, and if you're motivated and do your exercise well, then you will obviously get your range of movement back very quickly, and the stiffness will also come down fast. In short, total knee replacement is a wonderful procedure which can get rid of your knee pain fast and bring you back to normalcy very quickly. I hope you have understood what you need to expect from this procedure before and after the procedure, and what you should expect from your physio. Many thanks.